Hey everybody, you're on Injury Concepts page here on my website bodydoc.net, and today we're going to talk about a really cool subject actually, structural abdominal pain. And oftentimes I would have patients that would lie back on the table, and then you would see a sort of a big bulge in the middle of their abdomen. So as people are lowering themselves down to a table, the abdominal muscles fire very strongly to lower you down to the table. And what you'll see quite often is poking through shirts is this big old lump. And so, many years ago I began investigating, well, what is this lump? And I come to find out it's called a Diastasis recti, which is a tear of the linea alba. Linea alba, connective tissue that keeps those, sort of be the center of that six-pack that you would see on somebody who was really well developed. But that little band of fibrous tissue that lies right along the midline of your body can be torn. And what it does, it creates a separation. Now, it won't completely tear wide open, but they'll often be as wide as 2 or 3 inches in a very severe one. If you look up the research on the subject, actually, quite interestingly, it always talks about women who have given birth to children have had their abdomen stretched out for, let's say 6 months out of the 9 months of gestation. And so you can imagine how that pressure might sort of push open things and tear. But you actually see this quite often with men. And a lot of men that are actually trying to develop really nice flat stomachs and six-packs are plagued with this problem, because it simply is that the abdominal muscles are no longer ever going to touch. There's a big gap, and it tends to make it look like you're a little heavier than you really are. It's quite annoying. Very difficult. I've kind of counseled with a number of local surgeons on this subject, including the one that repaired my inguinal hernia years ago, and it's just a very challenging thing. There's a lot of pressure that goes through this part of our body. So the fixes for this problem are not very good, and a lot of surgeons don't get involved with it. Maybe that's changed since, but I don't think so. Anyway, what you find out is another little story I would share is back in chiropractic school, we had a couple of professors, and one of which, Dr. Lin, was a really funny man. I guess he was from Vietnam, and he had a couple of PhDs, a really bright man, and he said, when you see one thing broken, you're going to see other things broken. You see these things in situations where one part, like sort of hypermobility. I have another video on hypermobility. So oftentimes with patients, I will check an elbow breadth test to find out if their arm goes past straight. Then I might find that same amount of flexibility in other parts of the body, and I actually do. And it gives me some clues as to how to proceed with helping those particular patients from a genetic standpoint dealing with joint stability. But in this video, we're talking about a structural weakness of the abdomen. So what you'll often see is when you see that torn linea alba and that diastasis recti, you'll ask the patient, well, are you also having problems with GERD? Gastroesophageal reflux disorder or disease, or disorder I believe it is. And therefore, after they eat, they get a lot of backwash. So the stomach, the valve between your esophagus and your stomach, is also a bit compromised when you see this as a system. You might also find the incident of inguinal hernia. So all of this is in the abdominal cavity, basically starting from the bottom of your rib cage and ending in the bottom of your pelvis. So all of your gastrointestinal organs lie within this. And what you'll see is when you see a tear of the linea alba, you'll often see maybe an umbilical hernia, which is that little circle right there. This is the valve between the stomach and the esophagus, which can cause GERD. Down here, I've indicated a small circle to indicate that you might have a higher propensity towards hemorrhoid development. All of this stems back to the structural weakness of this area. So, what this video is all about, if you see one of those, you might have others. A lot of people that I've talked to over the years have really been helped by understanding one main thing. When you see a diastasis recti and a tear of that linea alba, almost everybody that's got that also has problems with gastric reflux, a really problematic thing where you sit in a restaurant booth, your legs are up higher towards you, so you're a little bit compressed, and there's gravity that's pushing the contents of the food that you're eating is supposed to be going down, but it can go back up when there's a valve that's broken, and they have a lot of problems with acid flowing back up into that lower esophagus, which can lead to cancerous cell formations there later in life. But this is something that's really nice. You get up after a meal, stand up, let that food get into that stomach, let it get lower into the stomach, into the duodenum, where there's a more competent valve that won't allow that backwash effect. And I've helped a lot of people over the years avoid the chronic Tums usage and acids. And they, again, what the point of all these videos is to teach and to share my knowledge of what I've seen clinically over the last 25 to 30 years of doing this for a living, and to help you more naturally solve some of the problems with gastric reflux disorders, which a lot of patients have. So I hope you enjoyed this. Take a look at that abdomen, see if it's together. If it is, you probably don't have any of these things, but if you see one, you're going to probably see others, and you don't have to run off and get a bunch of Tums and start affecting other systems. You can more naturally understand how to modify your behaviors and eliminate the symptomology, and you don't need pills or anything to do it, okay? Take care.